Well, a University of South Carolina researcher is involved in the efficacy of colorectal cancer screening in the community and is actively engaged in community outreach efforts focused on colorectal cancer awareness and the promotion of screenings. He is Dr. Frank Berger, the Research and Outreach Director within the Colorectal Cancer Prevention Network at UofSC. Dr. Berger, such a pleasure to have you with us. Tell us about the latest research you're doing there at the university.
Well, thank you for having me, Dondi. We're very much involved in promoting and understanding screening for colorectal cancer, particularly in the underserved and uninsured communities all around the state. We've partnered with a number of gastroenterologists and medical clinics to provide screening services, colonoscopy services, and other modalities to those who wouldn't normally have access to those procedures. And therefore, we feel we are reducing the toll of colorectal cancer, which remains a major source of cancer incidence and death in this country and around the world.
People who are regular WIS viewers know that I have been interviewing you for years. In fact, so many years, Dr. Berger, I can't remember. I tried to think today how long it is, but I've always had you on in March for so many years because of the research you're doing at the university. Your role has changed a little bit over the years, right?
Yeah, I've recently closed. I was working in my research laboratory doing basic molecular biology of colorectal cancer, and I kind of switched my emphasis a few years ago, and I actually closed my research lab, although I still work with a lot of basic researchers. But I spend most of my time now on the community outreach and colorectal cancer screening services that we provide around the state.
And part of that outreach includes activism. In fact, in 2017, you and I were part of a group from South Carolina that traveled to Washington, D.C. to speak to members of Congress. I want to show our viewers some of those pictures from that. Here we're seeing with Senator Tim Scott. And we were talking to members of Congress about what was nicknamed the Medicare loophole bill. This bill corrects a loophole in Medicare policy that caused beneficiaries to receive what really were unexpected bills for polyp removal during a screening colonoscopy. So how significant is this for our viewers that this is now passed?
Well, that is huge because under the Affordable Care Act, which got passed almost a decade ago now, colorectal cancer screening was mandated. What happened was, including people served by Medicare, people would go in for a screening and a polyp would be found and removed, and they would go in feeling like that all their costs would be covered, and they would wake up and find a copay because a polyp was removed, which changed the procedure from a screen to a diagnostic procedure. And that upset a lot of people. And I first heard about this when I would hear from primary care physicians who got calls from their patients that they had recommended to get a colonoscopy screen, who were calling up and were very, very angry and upset. And this was inhibiting people from seeking screening. So starting about 7-8 years ago, a number of organizations, including Fight Colorectal Cancer, which is the organization that hosted the meeting that you attended with us, the American Cancer Society's Cancer Action Network, worked very hard to promote changes in federal legislation that would remove the copay for a screening colonoscopy, even if a polyp was found and removed during the procedure. And this past December, the Congress approved and the President signed a bill which included removal of the Medicare loophole. It was in the COVID bill relief that was passed right at the end of the year. And so now Medicare beneficiaries, starting in 2022 and being phased in over the next few years, will have no copay if they go in for a screening colonoscopy, even if a polyp is found and removed during the procedure, which is the purpose of the screen in the first place.
And it was an honor to be able to go to Washington, D.C. with you and others, but also just a privilege for me to speak on behalf of so many of our viewers as we tell them to be healthy and to take these screenings. I do want to let them know that this correction, if you will happen gradually, with the cost actually being completely eliminated by the year 2030. Another thing I want to focus on with you, Dr. Berger, is the U.S. Preventive Services Task Force is now recommending people get a colonoscopy at the age of 45 rather than the usual 50. As we show some video of when I did it 5 years ago, when I turned 50, well, I was amazed at what an easy process it was, but I'm kind of floored because we have been telling viewers for so long the age is 50, and now we're being told, no, it is 45. So is this necessary, and why are you such an advocate for it being 45?
Well, this is a big concern because what was happening, we've learned that for people over 50, because of increased engagement in screening, colorectal cancer rates have gone down in the older population. But at the same time, for reasons we still haven't fully understood, for people under 50, including people in their 20s and 30s, several of whom you met when you were up in Washington a few years ago, I'm sure, that for a lot of people under 50, they were at increased risk and were showing up with higher incidences of colorectal cancers and higher mortalities for reasons we just didn't really understand. If you've met people, young people fighting colorectal cancer or parents of young adults fighting colorectal cancer, it's a very, very emotional situation. So we worked very hard to move legislation that would lower the screening age to 45. And the United States Public Services Task Force in October made that recommendation after a very, very detailed and thorough study of the situation, particularly for young people, and now have recommended that the screening age be lowered to 45 to get a large number of these under 50 age people screened. It's not official yet. We expect it to be officially announced by the task force sometime in the next few months.
All right, Dr. Frank Berger, University of South Carolina researcher, still just doing so many things for the awareness of colorectal cancer. And again, it is Colon Cancer Awareness Month, this month of March. So, Dr. Berger, as always, such a pleasure to interview you and get information from you. Thank you.
And I want to thank you, Dondi, for your advocacy and help in getting the word out on this very, very preventable disease. Thank you very much.
Preventable being the key word, which is why I love being able to educate my viewers, because we can cut down the numbers significantly. Dr. Berger, thank you.